I remember it like it was yesterday. It was September 5th, 2015, during an immunology exam. I started sweating. My heart started racing, and I had a terrible pain in my stomach. I had never experienced anything like it before. Dr. Pope made it very clear that we couldn't leave the exam room to go to the restroom. That was my first Shart attack.
Shart. Noun. A small, unintended defecation that occurs when one relaxes the anal sphincter to flatulate. Blend of poop and fart. Synonyms include code brown, mud butt.
Every 12.4 seconds, someone in the United States has a Shart attack. As a healthcare professional, it's by far the single most common thing I see in the clinical setting every day. By the time they show up to get help, it's too late.
You know, they say it could happen to anyone. You read about it in the news, you see it on TV, but you never expect it to happen to you. It was humiliating.
Moments before the attack occurs, patients usually experience a prodrome consisting of diaphoresis, malaise, supraventricular tachycardia, sphincter palpitations, abdominal cramping, violent flatulence, and the overwhelming sensation, equivalent to Mount Vesuvius, coming out of dormancy after 167 years and ripping through your levator ani muscles without mercy.
Alright, so what I'm going to do here is draw the rectum coming out of the anal column. You'll see here. Here's your anus right here. Here's your anal column, followed by the rectum. What happens in a Shart is that, find the right color here, a liquid bolus of fecal material builds up in the lower part of the rectum. Okay? And so then, when the individual decides to gamble by letting loose some flatulence, the problem is this liquid cap, this liquid bolus, is blocking the actual escape of the air up in the sigmoid colon. So, of course, that pressure buildup is going to shoot out the liquid Shart, and it falls into the panties.
In order to fully understand what happens during a Shart attack, let's delve into the forces at work. The inciting event usually involves the ingestion of questionable foodstuffs. As the bolus passes through the digestive system, it finds its way to the rectum. Now let's pause here and take a look at the equation that governs this unforgiving flux of septic filth. Flow equals delta P over R. As the pressure builds inside the rectum, the victim's sphincter begins to give way, which causes the resistance to drop. Now this decrease in afterload leads to simultaneously increase in flow, releasing the demon within.
Risk factors for Shart attacks include poor diet, diabetes, old age, high amounts of stress, obesity, congestive Shart failure, prolonged elevated mean Sharterial pressure, co-Shartation of the aorta, patent ductus Sharteriosis, congenital of course, history of myocardial infarction, family history of Shart attacks at an early age, eating at your local questionable Chinese buffet.
This is, I think, a really interesting topic because genetics plays a very significant role in the clinical presentation of Shart attacks. Although there is a significant environmental component as well. That tends to be especially a diet that's rich in fatty foods. The inheritance turns out, it's kind of interesting too, is a gain-of-function mutation in the SHRT gene, or SHRT gene. That codes for a protein that actually works as membrane pump. And it's a gain of function, and so it kind of makes sense that if you have increased expression of this membrane pump, you have an increased likelihood of having a Shart attack. Another aspect of the genetics is that it's on the mitochondrial genome. So that means only mothers can pass this gene on to the offspring. And this shows evidence contrary to popular belief, that women are not only affected by Shart attacks, but responsible for them as well.
There are multiple ways to treat this acute onset eruption. Many different classes of drugs have been FDA approved, but let us focus on the drug of choice, losartan. Losartan is administered as a suppository. When used correctly, the anus relaxes while simultaneously collapsing in on itself, creating an airtight seal, preventing the Shart from occurring. Side effects include unrelenting constipation, coffee ground emesis, halitosis, bloating, recurrent silent but deadly flatulence, and rectal prolapse.
I wouldn't wish it upon my worst enemy. The road to recovery has been long, agonizing. I have flashbacks about it all the time. But you know, I've finally come to terms with the fact that I'm a victim. And now I'm able to spread awareness for this debilitating disorder.
Many people are unaware as to how many individuals are actually afflicted by Shart attacks. So it's important to educate the general public on this terrible ailment, so we can finally stop the leak and heal all of those who have been traumatized.
Like me.
Like me.
Like me.
Like me.
Like us.
Like me.
Like us.
This is a public service announcement brought to you in part by the American Shart Association.